You are listening to the Tudor Dixon podcast, and if you listen to this show, you have probably heard me complain about the fact that after my kids turn 12 in my state, I no longer have control over their medical records, and it drives me crazy. They have to sign me over as medical proxy, and I still have very little information about their medical records as compared to what I have before they turn 12. So we said we need to have a doctor that can talk about this. And we found a great doctor, Dr. Kurt Maselli. He serves as the medical director for a medical watchdog, Do No Harm. Thank you so much for joining me today, doctor.
It's a pleasure to be here. Thank you for having me.
So do you hear this complaint a lot that parents are irritated that they lose control of their kids' medical records?
We have heard this complaint over and over. And just to sort of step back for a moment, as you noted, I work for an organization called Do No Harm. And one of our key missions and focuses as part of Do No Harm is really getting gender politics, gender ideology out of pediatric care. And so we focus on those less than 18 years old. And one of the things that many parents have come to us about is the fact that all of a sudden, when their child turns 12, 13, 14, just as you said, they're losing access to the electronic health record that they once had access to. And maybe they can see appointments, but even that sometimes is not clear. And frankly, we've even had one of our senior fellows who brought her child into an emergency room as a result of a broken bone. And she didn't have any access, again, to that child's record because he had crossed the magical threshold for whereby that hospital system had determined that access was not allowed and that we should maintain this sort of veil of silence over the record so that the adolescent is really the one in charge. And what you noted again is so very true that then parents have to actually ask their child for permission to look at their record, to regain that proxy access. And we've offered, numerous examples in our report as to where parents have actually encountered that. And it's really a terrible challenge. I mean, these are children, right? These are children that we have to remember. And these are parents who have a responsibility to care for their child. And much as we don't let children buy cigarettes or drink alcohol or heck, even vote, right? We maintain that there are certain things that parents really should be helping, informing, and guiding. And with healthcare, it is just so very complex and so important for parents to really be involved. And that's certainly within their lawful right.
We have tried many times in the state of Michigan to figure out where is this coming from. I've talked to legislators. I've talked to former legislators. We've talked to people who are running for office. I've talked to people in other states. I know this is the same in Iowa. I know it's in New York. I've heard there are many other states that California has the same situation. But I just want people to know that this is not a blue state situation. This is happening in multiple states. But is it a law or is it a rule coming from HHS? We don't really know why it's happening.
It's a great question that you ask. And I think much of this goes back really probably to the 1970s or so. And that relates to family planning and the like, and related to contraceptive care. And part of the thought was that these are sensitive topics that a child may not want their parent to be aware of or such. And the thought being that, well, we would rather have the child get access in terms of their health. Again, this is, viewed from the lens of more of a preventative type a philosophy, and we would rather that the child get access where they feel uncomfortable with talking about things perhaps related to contraceptive care, perhaps related to sexually transmitted infections. And as such, at a certain age, states have allowed those children, those adolescents, to be able to access that care, consent for it themselves without parents then knowing about it. And that's extended a bit to also treatment for substance use disorders. So whether it might relate to, again, a child who might be addicted to alcohol or opiates or the like, and even then to some mental health. And so, each state has laws on its books typically related to those issues. Again, there's variation, there's different ages and the like, but it's a sort of a narrow window. And I think what we've seen happen is that this is, with an electronic record, become much broader than just those sort of narrow issues. To the point, I was just on the University of Michigan website, Michigan Medicine, and it specifically says that notes for primary care, for psychiatry, are really not accessible by an adult unless they have their child, after the age of 11, give them access to those records. And so that's sort of a blanket disallowance of a parent, right? It's not related to these specific carve outs that are within the confines of state laws. It's this blanket. And when you have an EHR, we've looked at vendors like Epic, a major vendor, probably controls 40% or so of the market in terms of the electronic health record market with hospitals. Oracle, another big player in the field, controlling about 20 or so percent of the market. There are examples thereby in Oracle where they would provide guidance to a hospital and say, hey, you know what? Typically 13 is the default that we use for proxy access. Well, again, there's variation in state law. This is sort of a blanket recommendation that's coming through. Health systems we've seen oftentimes go along with that recommendation, and the consequence is that parents then get locked out of all of the records to the point of really being in the dark with what's going on with their child. And again, from the perspective of what's going on in terms of pronouns and social transition, and as it relates to gender ideology, that is definitely a concern that we have at Do No Harm. And again, parents, one of the reasons that parents have really voiced this issue in a rightfully in a very loud way. I mean, I'm a parent of a 7-year-old, a 5-year-old, and an 18-month-old, and I want to do obviously the very best for them, and I want to make sure that they're getting the very best in healthcare. And I frankly, and prior to really looking into this and hearing from parents, I wasn't as aware either that at a
No,
certain age,
you don't
yeah,
know until it happens to you. And that is also a complaint that I have. I see people running for office who are like, oh, I want to bring all of these services into the high school. And then you ask them, well, how do you make sure parents are aware that these medical services are being offered to their child in high school? Well, we'll have parental consent, but you don't have parental consent. You
yeah,
already have a law that says the parent has no vision into what is happening with the child, which is crazy to me. And like you said, it happens overnight. So this recently
mhm,
happened to us. I have two twins that just turned 12. They went in, one of them had a medical procedure at the hospital in Grand Rapids. We go in, have the medical procedure. I go to get the results. She had turned 12 the day before the appointment,
wow,
immediately shut out of her record. This was in June. I called the office and I said, okay, I forgot that she was turning 12, now can't see her records. And they said, we won't make an appointment specifically for your child to come in and just sign this
mm,
paper. And she can't sign unless the doctor is there to have a conversation with her. So you can wait until her well child visit in September. Are you
wow,
kidding me? You can
wow.
see her chart in September?
Yeah. It's absolutely absurd, right? I mean, this is a point where you want to be involved, you want to help your child, and your child, again, is 12 years old. And in
My
terms of
child can't make a decision on what
right,
we find out from this medical test. And
right.
yet I cannot see what happens for months because of
Yeah.
this stupid law.
Yeah, it's absolutely absurd, and I think unfortunately with an electronic health record, it even allows the bureaucracy to really dig in by just sealing off those records and cutting them off, which I imagine would be very different if perhaps that bureaucracy wasn't there, keeping in line with this crazy system that's just been entailed. And it is just so important whether from the state side or even the federal side, there's important guidance and clarity that potentially could come in terms of enforcing the privacy rule, because again, parents, you do have a right to help support your child and understand their protected health information, especially if it's within those lawful means. Like, you're not talking about these things that perhaps are related to substance use and such. This is related to the routine medical course of care, and that's
But
just totally
but let
inappropriate.
me let me give you a flip side situation to substance abuse and STDs, because when I'm in the midst of this and I am very frustrated by it, as you can tell, I talked to a nurse at a pediatrician's office and she said, "Oh, you think it's bad that you can't see your daughter's test that your daughter is allowing you to see?" She said, "Let me tell you what else is happening." She said, "I've got kids in the practice right now who have active STDs and they have been tested and it is positive, and they're going to have permanent harm if they do not get something done to treat these STDs,
Yeah.
but they don't want their parents to see the medication, so they're going without treatment, and we can't call mom and dad and say your kid is sick."
Wow. Wow. That's a real unintended consequence, right? I mean, the goal initially of these types of laws, again, if I sort of aim to look at it from that perspective, was to encourage kids to get access. But what you're describing is certainly kids then not even taking that access because of what's to come. And And I would think that any child wants that support from a parent, and in terms of making sure that, yeah, let's get the treatment, let's make sure you don't have those harmful consequences. I mean, even within the confines, when I was looking at the Michigan mental health law, it looks like that actually applies from age 14 and above, and not necessarily this sort of 12, 13 cutoff. But yet the record is just being withheld from you, and as in the example you've given, from age 12 onward. And again, more that is just inappropriate. And even within the confines of that law related to mental health in Michigan, the use of psychotropic medications, if they were indicated, still requires parental consent. So, I think we unfortunately have gotten to a point where we've probably implemented way beyond the scope of the law. And certainly an EHR has allowed that to go to a degree, unforeseen beforehand. And unfortunately, much as you've noted, we're end up harming children as opposed to really helping them, which again, every parent would certainly want to make sure that their child is getting the very best in healthcare, and to just be aware and to be cognizant of what they can do to help their kid.
Well, and at a certain point, I mean, this has been a confusion to me. If your child is going in to see the doctor and having tests done, it's showing up on the insurance that I pay. So am I not going to see it anyway?
You will see those that come on the explanation of benefits and the like. And frankly, this is one of the concerns that we've seen with gender medicine, and specifically related to the codes that are used there in terms of the diagnostic codes. And very typically, the diagnostic code one would use is typically gender identity disorder or gender dysphoria. But we have seen other codes that are being used, like endocrine disorder unspecified. And so I could imagine, if a parent sees endocrine disorder unspecified, well, they might think, well, what, does my child have diabetes, or do they have thyroid disease or something else? They're not necessarily thinking that, wow, they're receiving a treatment for gender affirming care, so to speak. So yeah, you're absolutely right. You would see those charges as those claims are filed, but then it has gotten into this question of, well, what are the codes that folks are actually using? And again, in the gender space, which we focused on at Do No Harm, that's one of the things that we're certainly curious to continue to look into more and more and understand, because if anything, using codes that are just completely inappropriate is really fraudulent.
Stick around for more coming up with Dr. Kurt Maselli, but do not leave if you are over 50 and you're worried about your heart health, because you need to listen to this. We've got this 16-year study of over 30,000 people that found that nattokinase, this is an ancient Japanese superfood that can help you reduce your heart attack risk and improve your cardiovascular health. And you might not know this, but Japan has the world's second longest life expectancy for this reason, because they've used this powerful natural enzyme for thousands of years. You might have never heard about it, but Luma Nutrition has perfected a powerful nattokinase formula. They are making it in the USA. It is third-party tested for purity and quality, and you should be buying your supplements from a source you can trust. So Luma Nutrition is the place to go. They were founded by a former U.S. Army officer, and they're on a mission to provide the highest quality natural supplements made right here in the USA. So you want to get your heart in shape. Try nattokinase today for up to 40% off when you visit lumanutrition.com. That's LUMA nutrition.com. Again, it's lumanutrition.com. They're veteran owned and proudly made in the USA. So check it out today, but stick around for more after this. So the gender space, to me, is one of the most criminal things we've ever seen happen to children. I mean, I think about a few years ago, we saw that there was female genital mutilation happening in a city in Michigan, and it was like raided by the police. I mean,
Yeah.
this was considered criminal. And yet you have children in schools being taken into aside to a gender clinic. You know, this is actually happening to kids, sterilizing someone's child without them knowing. How can this possibly? First of all, I think that the whole idea of cutting off children's body parts and stopping them from going through puberty and all of these things, I think it's all totally insane and horrible. It should never happen. But the fact that it's happening behind parents' back is even more sinister.
You're absolutely right. And there's a huge challenge that we have, whether it's with the school system or the healthcare system. And And the reality is that social transition is not innocent by any means. In fact, it leads one to be more likely to then be on a path towards puberty blockers, towards hormones, towards surgeries and the like. And so pronouns, social transition, these are things that a parent wants to be aware of. And certainly, again, for schools to be doing such or for doctors' offices to be doing such, it just goes against any grain in your body to be a parent, to help advocate for your child and to truly help them at a time of need, at a time of confusion. And that's oftentimes what we've seen, that there is much confusion. Puberty, adolescence, it's hard, right? I mean, and heck, we've all gone through it and the like. But at the same time, our treatment should really be much more from a psychotherapeutic, supportive modality, and not from all of a sudden moving to allowing someone to move into a different realm where, again, we're just allowing that confusion to take hold, as opposed to truly trying to find out what is the etiology behind it. Because oftentimes what we see is many of these children have comorbid psychiatric issues. They're struggling for other reasons: depression, anxiety, autism, and the like. And we really should be focused on treating those entities to allow them to get the health and the wellness that they need, not go with the gender affirming mindset and aim to affirm folks and then lead them on this path that just leads to terrible harms. And you're right. I mean, these are again innocent children. They're vulnerable. And certainly when they're being subject to these messages and this influence, whether they're getting it on social media, whether they're getting it in their school, whether they're getting it in their medical practice office, it's something that really does require parents to step in, embrace their child, to obviously love them as they do, and to really care for them and help nurture them through a challenging time in their life, not leave them out on their own to really the devices of a medical system that has just gone off the rails.
I mean, it's not even it's not on their own. They have a and I cannot understand what kind of doctor decides that this is an acceptable thing to do. Gender affirming would be to affirm that you are the gender
Mhm.
you were at birth. Like, this idea that this is delusion affirming. This is trying to create something that doesn't exist. And coming from my perspective, I've told people this many times. I'm a cancer survivor. I had a double mastectomy. I know what that's like. I knew the risks. I also knew that the risk of me not doing it was death. I would not have ever done it had that not been the risk. I know the changes in my body since then. I also was put on hormone blockers because of my cancer, so I know what that does to your body, and it's terrible. It's terrible. I mean, the only reason you would do this is to make sure that you don't die from something worse. And yet they are doing this to kids, putting them on hormone blockers. What in God's name do they think they are doing to these children, stopping them from going through puberty? So you're going to take away the human experience from these children. No chance. They're children. They can't make this decision. This idea that at 12, is total baloney. And they're going to take away their chances of having a relationship. They're not only going to take away their chances of having a relationship, but they're now forever harmed by this. They're either sterile or they've had their body parts removed. And if they've had their body parts removed, then they don't have any feeling in those areas, none whatsoever. It's not a pleasant way to live. And then you have these other situations where when you've had part of your body removed, you have like phantom feelings in other parts of your body that are constantly annoying you. I'm not talking about this from from things I've read. I'm talking about this from my own life, what I've gone through. And I know it is a wicked, wicked, terrible treatment. And yet they're doing this to kids that aren't sick.
Yeah. It's bewildering, and your testimony is extraordinarily powerful as someone who is a cancer survivor, and to think that, right, these are healthy kids with healthy body parts, and we're hurting them in so many ways, and we're even telling them that, oh, it's reversible, or we're not even discussing what the
It's
potential
not.
long-term. Exactly, it's absolutely insane. And it's just completely wrong. And I think at a time when we need to really restore trust into the medical system and restore that honor of the doctor-patient relationship, we as a medical community really need to really work on this issue And we haven't. I mean, unfortunately, many of the medical societies and the like have been captured by this ideology as opposed to really looking at what is truly best for the child. And unfortunately, we've sold these lies to parents by telling them that their child is going to be at a higher rate of committing suicide when that's, again, just not true. If you look at the data, it's related to the comorbid psychiatric illness that the child is suffering from, not to the gender dysphoria, and not that these treatments in any ways actually helped resolve those issues. In fact, oftentimes they make them worse. So
And there is this weird protection of information, or like the hiding, I would say, of information, because for those of us who know what this experience is like, and I will say that I went through all these treatments because I had hormone receptive cancer, which means my cancer grows on hormones, which is why they blocked the female hormones, which is why they did the double mastectomy. But when it came down to having a hysterectomy, my doctor said, you are too young to have a hysterectomy because the benefits do not outweigh the risks. You would have so many problems at 38 if you had a hysterectomy. And we're going to say, we'll monitor you rather than take your uterus out, or do the hysterectomy and cause you all these other harms that are going to cause you to have brittle bones, cause you to be depressed, cause you to go through a menopause immediately. And yet they're doing this to young girls. And I'm just like, how is it possible that me at 38 who had cancer and has a true reason, they weighed that and they said, your health would be so horrible if we did this to you that we will not even take that risk to potentially save your life. We're going to monitor you. For a child, they're telling parents, you will end up with a dead daughter if you do not allow her to become a son, and have her go through one of the most challenging experiences of your life, to go through menopause overnight as a child. It's just so sick.
I couldn't agree more. And it's one of the things that we've seen in our Stop the Harm database that we've done at Do No Harm, is to actually look at the claims data from 2019 to 2023. And we saw over 5,700 surgeries on innocent, vulnerable children. And it is just absolutely awful and tragic. And that's throughout the nation. It's not isolated to a certain region of the sort. It's throughout the nation. And it really speaks to the concerns and well, what we need to really do to do much better for our children, for our society. Because you're right, these harms are real, and you speak to detransitioners, and they will also tell you firsthand of the horrors that they've been through and how the medical system just so let them down.
And that's another thing. They're silenced. It's like they're not allowed to speak. They have betrayed the cult and they are not allowed to speak about it. And they're not right. This is not happening. And yet you say surgeries. I call these experiments. The fact that many children have been cut apart like Frankenstein, this is so sick.
Yeah. You're absolutely right. And I think it really goes to the courage of those detransitioners who are able to speak out and to provide that, really their story, and they're just heart-wrenching. They're absolutely horrible stories to hear because of what medicine has done to them. And certainly as a psychiatrist, it makes me squirm, because I think that my association, the American Psychiatric Association, to actually endorse this kind of model of care is just completely absurd, when we really should be using our talk therapy, our therapeutic techniques and such, to really help children, and to recognize that you're absolutely right. Affirming your biological sex of who you are and embracing who you are, and to be able to have comfort with that, as opposed to thinking that you need to be something that you're not. And it is just so absolutely critical. And to the point of the electronic health record, unfortunately, in many regards, with with the WPATH, the World Professional Association of Transgender Health, I think it was back in 2011 or so, they were recommending different types of guidance of what to actually add into the electronic health record related to an organ inventory, or this idea of sex assigned at birth. And ultimately in 2015, I believe HHS then did sort of mandate that, yeah, we need to actually have this gender identity embedded in the electronic health record. And by 2018, you find that Epic is doing a trial basis of, again, an organ inventory, sex assigned at birth, pronouns, the whole
What
9
does
yards.
that mean, an organ inventory?
To actually account for the organs that one has. So to note the sex organs that one has, because apparently we can no longer really trust the sex marker. So now we're going to do an actual organ inventory of folks to note that they have a uterus or they have what ovaries and the like. And it's become absurd. And I don't think you don't need to be a doctor or anyone of the sort. You just need to recognize that there is male and there is female. And yet we've gone into this world where we've just ignored that biological reality to the point that an organ inventory actually exists in electronic health records.
There are mental disorders that exist, but are extremely rare, like extremely rare. And gender dysphoria is one of those that is extremely rare. This idea that this is common and suddenly all of these kids have this. What is the root cause of this? And that seems to be the problem, is that it's not necessarily that they have come to decide this. It's that they feel something's off, and maybe it is autism or something like that, but they tend to go to somebody for care, and these detransitioners often have stories that they were told, well, you're probably in the wrong body. Come on. I mean, you went to school for this. You know that that's not what you were taught. Like, oh, there's just a massive amount of people that feel uncomfortable. They don't know this. They're actually in the wrong body.
You're absolutely right. If you look at the DSM, so the manual that psychiatrists typically use, and if you look at the fourth edition as opposed to the fifth edition, which is the current one, but the fourth edition actually shows rates of maybe 1 in 30,000 to 1 in 100,000 have gender identity disorder, as it was called in the DSM-4. And even in the DSM-5, those prevalence rates aren't much more common. But we have seen this sort of social contagion phenomenon really in the past, I guess, decade, that has mostly affected girls, adolescent girls. And traditionally, gender identity disorder was typically boys, often at a young age, who sort of had some confusion, 4, 5, 6 years old. They might sort of be experiencing such confusion that then, for most of them, the vast majority, like 80 to 90%, actually desists and goes away. But for some, it sort of remains. And again, very rare in its occurrence. But now we've come to this point where we have all of these adolescent girls, and oftentimes, again, in social clusters, typically related to social media or perhaps school cliques and the like. And we've also seen this idolization of the trans status. And so it has just had this tremendous boost of almost 1,000% higher in terms of what we see. And also, for many of those folks, there's this idea of being non-binary. So not even necessarily being a woman or a man, but being something in between. And which, again, I think perhaps speaks more to the social contagion aspect of it, because it's sort of pointing to something that is completely not biological by any means, but this sort of gray area that again just sort of really, I think, proves the point of a social contagion phenomenon. And it's something that we, again, in society where you have schools that may silently transition kids, or hospital systems doing the same, or encouraging these thought processes within other clinical venues, we've got to change that. We've really have to refocus on who is before us, look at the child, and help that distressed child, not put them on a pathway and just sort of label them in this gender dysphoria mindset that leads to hormones, puberty blockers, and surgeries.
Well, my audience probably knows where I'm going to go with this, but we've had people on recently who have been harmed by SSRIs. And as a psychiatrist, you know that the system has sort of changed from when I was in college. It was like you went to school for therapy, or you went to school for psychology, you went to graduate school for psychiatry, and then you ended up treating patients, but also having those conversations, like you said, that talk, that discussion. And now it's like you have the psychologist, they do the discussion. You have the medical doctor, the psychiatrist who goes to medical school, and they just prescribe. And there seems to be a disconnect there. Well, I've had these patients on who have talked about, and the FDA just had a panel a few months ago about this, that these SSRIs, in many cases, causing people to become asexual. They are castrating them. They have no feeling. They have no sexual desire. If this, and this one patient that we had on made a very interesting point. She was like, look, this happened to me when I was 20. I was sexually active. I went through depression during the pandemic. I was on this for 6 weeks. I am permanently castrated. My emotions are permanently stunted. My ability to have any type of sexual arousal totally gone. And she said, I can't imagine for these children who are put on this at 6, 11, 12, 14 years old, who have never had a sexual relationship before. Then they get to puberty and they don't feel anything because these drugs have changed them. I mean, why aren't we looking at the potential of this is not just a natural occurrence? What is the medical history of these children?
Your point is one that any good clinician would certainly take, and that's to really assess and understand who the patient is that's before them. And I think unfortunately in our society we've gone to a much quicker way of diagnosing and treating. And perhaps even within our society, we've come to a sense of we just want the quick fix. But I think the reality is that we need to sort of do the work of the therapy. We need to do the work of understanding what the etiology is. We need to do the proper assessments and such. There certainly is a time and a place for medication. I don't want to sort of speak against it. I prescribed SSRIs in the past and I've seen remarkable results. And then there are other times where, you know what, maybe that's not the appropriate indication. And maybe we've been too quick to actually put someone on such a drug. And maybe we should have tried other things beforehand. I mean, there are solid psychotherapeutic modalities, whether it's cognitive behavioral therapy or other types of model psychodynamic psychotherapy that can be used. And again, that takes more work, more time in terms of what the commitment that one needs and on both parts of the provider as well as the patient. But unfortunately, yeah, you've pointed out that separation that psychiatry has seen, where psychiatry has become more of a medication management and less of a therapeutic model. And I think it behooves us to either partner very closely with our psychology friends to really approach the patient in unison, or to provide the psychotherapy ourselves as psychiatrists. And again, after a good, solid assessment and understanding of who that person is, understanding goals of care, always explaining risks and benefits so that one can truly understand them, in the right way, so they can make the right decisions. There's a lot of work that needs to be done, and again, there are many good providers out there who are doing such work. But unfortunately, there's also the reflex that we see where prescriptions may be written maybe more quickly than they should, and there's important for us to take a step back and really understand what's going on.
Yeah, I mean, it does seem like we are an over-medicated society, and I've gotten to the point where I've heard teachers go to parents and say, "Your kid is too active in the classroom. You need to medicate the child." And it seems like, you know, is that just I mean, you're not a medical doctor if you're a teacher, is that just you just want it to be easier on you, or what is the situation? And I do think that we are quick to jump to that today. But I also think, like you've said, you're protecting these kids against a lot of these gender harms that are happening also at school or by someone close by that's saying, you know what, we think this. So tell us a little bit about how Do Not Harm work, or Do No Harm works, and how people can help with your organization.
Absolutely. So we are a membership organization. We have over 40,000 members as part of Do No Harm, and those are healthcare providers as well as concerned citizens. So we have all sorts of folks from all different walks of life across the nation, and we'd certainly welcome folks to join. Membership is free. It's donoharmmedicine.org. People can sign up and become a member. We really do aim to provide folks with a wealth of information on the two issues that we deal with. So the one, really keeping kids safe from this harmful gender ideology, and the other being getting identity politics out of medicine, which again, I think is very much linked to the gender ideology part, because there is just the politics has been injected into medicine in a very bad way, and we've seen the awful consequences as you've articulated. So those are really our two focus points and issues. And, in my mind, it's really about the culture of medicine. Who are we as providers, and the importance for us to really return to focusing on the patient, focusing on quality, focusing on doing what's right, really bringing that art and science back to medicine, again, getting politics out of that exam room, and again, doing right by our kids.
I mean, isn't there something you sign that says you're not going to harm the patients? I guess it's just
There's
shocking
an
that
oath.
this. Yeah.
There's a Hippocratic oath, and heck, our name comes from that, right? And oftentimes attributed to the Hippocratic oath is the essence of do no harm. And absolutely, that's the first principle of being a physician. And there are other ethical principles that we operate under, and I think unfortunately one of those principles is this principle of autonomy. Although that has led very much to, when we're solely focused on autonomy, we lose track of the other professional aspects of our ethics, the beneficence that we're to apply, the do no harm that we're to apply, the essence of not, again, hurting people and really helping them to understand the risks, the benefits. And it behooves us to be those professionals as opposed to, certainly in the gender care, going to this sort of child-led modality. And that is the wrong way to really practice, right? It's about a provider being a professional within the room, explaining and helping to understand, to diagnose appropriately, and to treat and to use all of those ethical principles when we provide care.
It's just so hard to grasp because when I went through these surgeries, there was so much discussion ahead of time. And it was
Hmm.
like, this is what's going to happen to you. Could be the consequences. This is what you'll feel. You'll have these electrical zaps, all of these things that you deal with for the rest of your life. This is what the rest of your life will look like after this. And yet I talked to these detransitioners and they were never told that.
Right.
Or I think, maybe they were just too young to really understand what that meant. I mean, it blows my mind. So I am so grateful to you for what you do at Do No Harm. We appreciate you coming on today. And for anybody who's listening, his name is Dr. Kurt Maselli. We are so thankful. Thank you for coming on.
Thanks for having me.
Absolutely. And thank you all for listening to this podcast. As you know, check out our podcast on the iHeartRadio app, Apple Podcast, Rumble, or YouTube at Tudor Dixon. And make sure you join us next time. Have a blessed day.